Welcome, everyone. Thank you so much for joining us today. My name is Dr. Louise Ivers, and I'm the director of the Harvard Global Health Institute. I'm a professor of medicine and professor of global health and social medicine here at Harvard. I'm delighted to welcome you to HCHI's Coffee Sessions. This is our virtual series bringing together voices from across the global health landscape, working to advance global health equity. In recognition of the growing complexities around the US's engagement in global health, today we're focusing on examining misinformation and distrust in science and trying to identify collaborative solutions in how to rebuild trust, empower informed decision making, and strengthen efforts towards global health equity and health for all. This issue keeps being more and more relevant every week, in my view. This week, we saw major actions related to the United States Vaccine Advisory Panel, and we heard comments from RFK Jr., the US Secretary for Health and Human Services, who made misleading comments about Gavi, the Vaccine Alliance's procedures and safety monitoring, and we saw the US pulling back from any support to Gavi. I'll mention that this session is being recorded through Zoom, and the recording will be made available on the HCHI website and our YouTube page in the coming days. We're going to have time at the end of the presentation for your questions. So if you have a question, please submit it through the Q&A feature on the bottom of your screen, and we're going to do our best to get to those questions towards the end of the event. We have two phenomenal speakers with us today, and I'm so thrilled that they accepted our invitation. Please allow me to introduce them. Professor Heidi Larson is professor of anthropology, risk, and decision science, and director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. She also holds a concurrent appointment as clinical professor of health metrics sciences at the University of Washington. She has led global efforts in immunization, having headed global immunization communication at UNICEF, chaired Gavi's advocacy task force, and served on the World Health Organization's SAGE working group on vaccine hesitancy. She's the author of a tremendous book called Stuck: How Vaccine Rumors Start and Why They Don't Go Away. In 2021, she was awarded the Edinburgh Medal and was named by the BBC as one of the 100 most influential women in the world. Professor Seth Mnookin is professor of science writing and the director of the graduate program in science writing at MIT. He's a longtime journalist and science writer and was a 2019-2020 Guggenheim Fellow. His most recent book, The Panic Virus: The True Story Behind the Vaccine Autism Controversy, is a must read for anyone. It won the National Association of Science Writers Science and Society Award and the New England chapter of the American Medical Writers Association of Science Writers. His work has appeared in numerous publications, including the New York Times, Vanity Fair, the Washington Post, the Boston Globe, Spin, and Slate. He graduated from Harvard College in 1994 with a degree in history and science, and he was a 2004 Shorenstein Fellow at Harvard's Kennedy School of Government. Professors Larson and Mnookin, it's really an honor to have us with you here today. Thank you so much.
Thank you for having us.
So it's a pleasure. Um, let's get started with trying to define the problem a little bit. And I'm going to start with you, Seth, if that's okay. Could you clarify for us how you distinguish between misinformation and disinformation? How do we tell those apart from just honest debate, discussion, and different points of view?
Yeah, that's a great question. One of the ways that I think about it, I think of misinformation as information that's being distributed that's incorrect. That people might not be checking it, or it gets currency on social media and it starts to take on a life of its own. Disinformation is deliberate efforts to misinform people. That's how I would define it. So when there are deliberate misinformation campaigns, I think of that as disinformation, as opposed to misinformation, which usually starts from a place of not knowing the answer to something or being unclear about something. I think one of the things that's really challenging right now is it's very hard to distinguish between the two. It's very hard to know whether when people are saying things that we know are not true, that we have a lot of evidence showing are not true, if those people are speaking from a place of deliberate intent to mislead or being misinformed. And it's also very difficult to know what to do about it in either situation.
Thank you. Heidi, do you want to add to that? And maybe you could also help us understand a little how the nature and the scale of some of this has changed over time. You've been studying rumors and especially vaccine hesitancy, but other things too, as an anthropologist. How has this shifted, and how does technology and other aspects of society introduce new dynamics?
Thanks, both Seth and, and Louise. It's been it's been dramatic, the change, and I mean, misinformation and even disinformation has historically, punctuated history, but it's the scope and scale of it, powered by new technologies, by social media, which I mean, in retrospect, it's really relatively recently. I mean, Andrew Wakefield's, I guess, infamous paper on suggesting MMR and autism fell on the same year that Google opened its doors. I don't think he ever imagined that he would have the platform that he had. He also spoke out well beyond the paper, and continued as a champion and used the technology to a to whatever was available. And then, it's really barely 20 years ago, not even, that Facebook, Twitter, a number of the social media platforms really got going and have increasingly diversified globally. We've been monitoring that. I mean, we founded the Vaccine Confidence Project in 2010. And it's been remarkable. In a way, we've grown with the expansion of the technology environment. We actually started looking at online news media because we didn't think at the time social media was ubiquitous enough to give a globally comparative look at trends and picking up signals of misinformation. But fast forward, we've been following it, and what I guess I would, and others would call swarms are happening online, really accelerated everything. I have to add that COVID has just thrown the scope and scale off the charts, um, because for vaccine related discussions, they pretty much stayed in circles of mothers, maybe adolescent girls, maybe some older ages looking for different kinds of vaccines, but very much in certain circles. With COVID, number of different groups all merged together and under anti-government control. And um, we have just an absolutely different environment now, and a huge challenge.
Thank you. How do you think so in that context, that we can help the public uh, better distinguish between, and Seth, you mentioned sometimes it's hard to know, well, which is disinformation, misinformation, and the scale and scope of it. How do you mentioned how could we help the public to better be able to distinguish between the credible and non-credible, or not, or debunked or not scientific sources of evidence?
I, I think that's going to be an enormous challenge moving forward because the answer to that used to be, if there are things that that people are telling you about vaccines, about public health, about anything, a good resource is the CDC. A good resource is government agencies that deal with public health, that deal with vaccines, that deal with licensing. And now it seems that there's a pretty dramatic shift, and those agencies I think it's going to be much more difficult to look to them for the type of accurate information that we're used to. And so really what we're asking the public to do is become experts in the science on their own, saying, well, why don't you go look in the New England Journal of Medicine and see if the results that are shown there or in the Lancet or in the British Medical Journal match up with what you're being told that's coming out of Washington. And I think that's an almost impossible challenge for the public. And so what these misinformation and disinformation campaigns have done is create a scenario in which there's really chaos and confusion. And that always benefits people who are pushing misinformation and disinformation. Chaos in these situations is always going to be the enemy of truth. And that creates a real challenge. So, what I've been telling people, individuals, when they ask me is talk to your doctor, talk to your healthcare provider, talk to the people who you trust to make and help you make decisions about your health on a daily basis. Don't try and go and wade through competing studies or competing articles, because that's something that even experts can find challenging.
Yeah, Heidi, do you want to add anything to
Yeah,
that?
I mean, I think it's I think in a way it's back to where, go back to the old faithful, your GP. I mean, we see that trust in family members and trust in family doctors is higher than trust in just about anything, including scientists. And to the extent that, I mean, the challenge right now is that a lot of GPs and health professionals themselves are um, a bit hesitant to engage in these complicated, sometimes heated discussions. They're happy to give the information, but they don't want to be seen as being put in the hot seat to persuade parents, because that's a difficult place to be, particularly in the highly combative and questioning environment. On the other hand, it's super important that they can at least reassure people of safety issues and others. I think another part of the challenge has been that the public health community has been so anxious and not present in the social media landscape
Yeah.
in the last decade that we've just rolled out the red carpet for all the alternative voices. And what we see now is it's like what's online is not true, and what's, in the pamphlet in your office is the truth. But that's not where people are. And they also say they don't find the answers to the questions they want on the CDC or NIH or WHO websites, because that information is what the agencies want you to know, not the questions we as parents have. So I think we really have to ramp up on our online presence. I have a lot of hope and confidence in a younger generation of doctors and scientists who are more digital savvy and probably less anxious about uh, operating online. But, it's not just, we're way past the, individual fact-checking mode. I think really finding alternatives offline is going to be super important.
Yeah, it's interesting because as you mentioned, kind of the healthcare provider that you trust, and I know also nurses always rate very highly on the public's, at least in the US and surveys I've seen, very highly in the public's trust mode. And yet if I look at just on the US side, healthcare is also in crisis and the health workforce is overstressed. And then you mentioned too how COVID has impacted all of this. I remember seeing during COVID, a lot of people took to social media to try to offer advice and information. And it wasn't always really the experts in public health who were doing that. And that had its downsides too. Could you speak a little bit to how you both saw that impact of the COVID pandemic? Some of it was also about distrust in the government and the vaccine, etc. Any thoughts on that specifically?
Yeah, I mean, I think
Right.
one thing that the COVID that the development of the COVID vaccine and the rollout of the COVID vaccine illustrated really clearly is the difference between science and English or colloquial language wherever you happen to be living. And that's always been an issue in public health and science, because scientists won't say, yes, I know this. I know human beings can't fly. What they will say is, when I look at all of the evidence in front of me, I'm reasonably confident that human beings will not be able to fly. However, I'm also open to the possibility that something might change in the future. That, to a speaker of English, sounds like, oh, well, we're about to fly. When in fact, obviously, no one would go to the top of their building and jump off and think like, well, maybe this time this will work. And so we saw that a lot around COVID. We saw that with the discussion around masks. I think we also saw a real anxiety around public health communicating, whereas the initial advice around masks, not to wear masks, was so obviously and sort of patently incorrect on one level. Of course, masks are going to offer some protection for infectious diseases, but we didn't trust the public enough to say, we need these masks in hospital settings. That's where it's really crucial that we have these. And as long as people are isolating themselves and quarantining, that's not, please don't buy up all of these masks that we need when we're running short in hospitals. We have a pretty poor track record of communicating with that level of honesty. And I think also, something Heidi said, that we're way behind the curve. The public health community is way behind the curve. I think we have really resisted creative solutions to some of these problems. One in the US, one eternal issue is you get 15 minutes with your doctor for a wellness checkup. And that's not enough time, obviously, to ask a lot of in-depth questions about anything. 15 years ago, I made a recommendation that pediatricians' offices should have office hours and should have like nights where different families can come together and talk to an expert in that office about vaccines or about something else. And the answer I got was, well, how do you bill that? What are the insurance codes for that? If we're not going to get paid, then how are we going to do it? And all those are, I'm not belittling those questions, but I think that is the type of sort of myopic thinking that makes it harder for us to find creative solutions to the challenges that we're facing.
Thanks. And Heidi, I know, correct me if I'm wrong, but I've heard you speak before about a study or looking at the amount of information provided, say, in a pamphlet, and if there's too much, way too much
Yeah.
versus the middle, and maybe that speaks to a bit of what Seth was saying about going overboard with scientific specificity that doesn't really land with the general public.
Yeah, it's kind of finding it was a commentary, but that was talking about. I find myself writing more and more commentaries that are kind of trying to digest the scientific articles and help them make sense. And that was one that actually was really valuable, but I didn't know if it was going to reach the right people. But it was a really important. It was a small study, but it was looking at the adverse events reporting system, which is not well titled because adverse events don't necessarily mean they're caused by vaccines, although the title suggests it, to the lay population. And what it was showing is that if you have she did a comparison, a small trial comparing just the standard pamphlet you get about vaccines and their risks and benefits, more detail, and then a lot of detail. I guess that's the best way. And basically found that the medium one, which had more than just your standard pamphlet, built trust and confidence, and actually increased kind of trust in the safety of the vaccine. Whereas if it was too simple, it didn't build confidence, and if it overloaded it with all the multiple possible risks, whatever their proportion was, then you'd lose people. Then they got really scared. So I think finding enough that shares transparency, but not overwhelm people with. I'm not saying that they shouldn't have transparency, but a lot of it is either so remote or, is really not in a day-to-day life needed to know. So I think, people are, they dismiss um, their trust, I don't know, barometer or whatever you want to call it. Um, the public health system is always afraid to give too much information that it might, scare people. Well, it scares them a lot more if you give them too little.
And Seth, you wrote in your book, I'm going to quote something from your book, The Panic Virus, truth has been demoted to a matter of feeling. Science is talked about as a question of faith. Can you speak a bit more about this and, the risks of when scientific facts are perceived as being ideological, um, rather than based in evidence?
Yeah. What I meant by that, and I think this is something that, and Heidi referred to this and has done some great work on this, has been social media has really exacerbated this issue, is a sort of misapprehension among the general public that the plural of anecdote is data, which obviously is not true. And so what you see a lot online is someone saying, well, this happened to me, this happened to my child, and I really feel like that means that this is true. And then someone else will chime in, and then all of a sudden you have 20, 30, 50 people, and that feels like a million people in the context of social media saying this same thing. Whereas, and which is not to say that any of those specific things didn't happen, but the causality is likely not what those people think it is. There was a great example, a pediatrician that I was talking to who was about to give a child, a 6-month-old, a pediatric vaccine. And the parent had a question. And so she stopped right before the vaccine. And in between, when the parent asked the question and she was able to give the vaccine, the child had a seizure. So pre-vaccine, this child had a seizure, which happens. Children have seizures. If I had been that parent, and that shot had preceded the vaccine, there's nothing you could have told me that would have convinced me that it was not caused by that vaccine. And so that's what we're seeing a lot in online communities. And I think the challenge there is, and I think this is something also that has been a problem for us and the public health community, is being able to address the experiences of those people respectfully and also explain why science is not a matter of faith. We have evidence and we use evidence to make decisions. And if you put it in a larger framework, even though science is coming under question a lot right now, obviously as a society, we have enormous faith in science and in research and in experimentation. We get in planes every day and don't assume that they're going to fall out of the sky. We wear seatbelts, even though they're sometimes not comfortable, because of all of the evidence that if you get in a crash, that's going to help save your life. Smoking has plummeted based on research and evidence. But around these public health issues that become contested and debated, it really becomes an issue of, well, I feel this and they're telling me that and they say this. And that's, I think, when you get into a lot of trouble because, again, the language of science is never going to be able to compete with personal experience and personal narratives and personal anecdotes because that's how human beings understand the world. We understand the world through stories, not through data.
Thank you. I want to build on that a bit with a question to you, Heidi, about rumors, because I found it really fascinating as I was reading your book to think about rumors in a different way than I had thought about them before, as usually just something bad. But you helped me understand how they can be signals of important things. And this to me is maybe building on what Seth's describing about the individual anecdotal cases. That can be helpful at times, right? And it also helps you understand what people are thinking. Could you speak a little bit more to us about and to the audience about rumors?
Yeah, I mean, I think rumors by definition is an unverified piece of information. It's not yet verified. Some of them stick and become, I guess, what we would call myth, but others resolve themselves, and you either find out they're true or they're not true. But when they emerge, I think we should be very careful, particularly in public health, particularly when it comes to brand new diseases or diseases, for instance, we're trying to eradicate, like in smallpox. In the basement of the World Health Organization, they have rumor files from the smallpox eradication initiative, because particularly towards the end, when they were looking for any last evidence of, another case of smallpox, they were critically listening for rumors. Not that they all turned out to be a case, but they were signals. And I think, they've used that in different kinds of diseases, even SARS and H1N1, particularly SARS. So I think we have to be, in the same way, I think we have to be careful in dismissing parental concerns about vaccine side effects, because sometimes I think the medical and public health community gets so defensive that they're missing something that actually could be really important. And I think particularly like with COVID, um, there's we've vaccinated billions of people. And actually, it's remarkable. There were so few serious side effects that were confirmed to be related. But, I think I would really be hesitant to be dismissive of anything we hear. So I think that's important. And we do have, as you read in the book, that there are some age-old rumors like anxieties about fertility and sterilization, which is one of the oldest ones in the book. And that's pretty existential. If you're a marginalized community in a government that would rather not have you there and they haven't done anything for you, when there's a mass vaccination campaign, they're like, I don't know, maybe that the doses for us are going to wipe us out. It's pretty existential. So I think there are patterns there and some of them just wait for an opportunity when there's a scare, and then all the old rumors come back.
Thank
I
you.
think,
Um, so a rumor is unverified piece of information. Then now, when you have a politician or leader, a member of the government, let's say in the United States, who is embracing either the misinformation or disinformation, I won't judge yet on that at the moment, but how does that, and Seth, I'll pose this one to you. How does this kind of rhetoric reshape the relationship to science and truth? And we'll come shortly to some of the solutions and tools we might have, but just for now to kind of frame the issue.
yeah, let me circle back to that in 1 second. I just want to comment on one thing that Heidi said that I think is so important, and that's listening to rumors. My view, and this is a theory, not a proven fact, is that what we're seeing now around the world in 2024, basically in every democracy in the world, the ruling party was thrown out of power. It didn't matter if they were on the right or the left. And I think one of the things that was the result of was an enormous amount of frustration about COVID, about the fact that people were locked up for 2 years, that they couldn't see their friends, that their kids were stuck not being in school. And I think that's an example. And so during that, obviously, there were a ton of rumors, like the government is trying to control us, or it doesn't want people to get together, or they're trying to take away our rights. Um, Listening to those type of rumors and paying more attention to the emotional content underneath those would have been, I think, so important, because if we had had more leaders coming out and saying, instead of stay inside, don't do this, saying, this sucks. I know this sucks. It sucks for me. If I had kids, it would suck triply so. You might have had less frustration building up, but there was this sense of governments working against the public instead of empathizing and working with them. And that's one of the reasons why I think what Heidi said is so important and so crucial. Um, yeah, getting back to your actual question, I think that is going to be one of the central challenges of the next couple of years. Because when you have people in government, and it's something that you see not just in public health, all of these areas of government that had previously been thought of as sort of being outside of politics are now being politicized. So the Fed is being politicized in very obvious and very big ways. Public health is obviously being politicized. And so it's going to create not only problems for us right now, but problems in the future. Let's say there is another administration that takes a different approach to public health than this one does. It's going to be very hard to communicate to the public, no, this is an administration that is looking at science in a more traditional way. And that's a challenge that I think is going to be really, really hard. And as Heidi said, is going to take creative thinking for the public health community to sort of work through. And I think Heidi is exactly right when she says that we've been too reactive and not proactive enough.
Thanks. And Heidi, could you speak a little bit to how some of what's happening on the US side is influencing or not, or impacting what's happening in Europe and the rest of the world? I know you work in Europe, in London, and also have worked all over the globe.
Well, it's it's not a necessary, there's the direct and the indirect aspects. Directly, some of these perceptions travel, and we've seen, and English, it's one of the most ubiquitous languages, and that's an asset sometimes. But I mean, I know there's a lot of translation tools right now, which sometimes, given their accuracy, can also contribute to the rumors, but there are direct misinformation that spreads, and actually Africa is one of the quickest places to pick up on some of the things circulating in the US. But what is even more concerning to me is not the specific traveling of different pieces of misinformation, but the fact that when you have the heads of government and health uh, uh, speaking some of the things that are not consistent with science, it emboldens people all over the world who are hesitant and have either concerns or heard things that are believing misinformation. And then they're like, I was right after all, because if they're saying that, I'm on a path. So this, we often talk in vaccine hesitancy, analyses that hesitancy band is between those who are kind of, you know, instinctively pro and accepting, and those who are kind of more adamant refusers. Well, that band in the middle, if they're a bit leaning to the questioning and they just got a major dose of endorsement for their alternative views.
And one of the things that I find challenging myself as I try to, I'm an infectious diseases doctor by training, and as I try to break down some of the commentary that I see is that there's often a note, like a kernel of some science or some fact, but then it's misapplied or it's misexplained or it's not described correctly, or it is information that has been studied and debunked but is brought back in. And Seth, you spoke about chaos, and it then seems like it's hard to break down and also not over explain. So I find it difficult, even myself, to think about how would I try to address that.
Yeah.
I'd love to spend a few minutes with you both thinking about specifics about ways to approach this. And we've talked about many of the challenges, and you've each spoken to trust and building trust and transparency and honesty. And the general public is smart and intelligent and cares about their children and their family and cares about their neighbors and their community. And generally speaking, en masse, everyone wants to do the right thing, but they don't want to be taken for granted or thought to be stupid, and they want to be told the truth. So, how do you think in this new era of social media or new media, how do we find the right people to speak to this? Or can you share a little bit about the tactics that we could embrace? You've touched on some of them. I don't know who'd like to speak first.
I can offer something, and then Heidi can say something more intelligent, and so we can end on that, on her instead of me, for this question. Yeah, I think you're exactly right that oftentimes inaccurate information has a kernel of truth. Mercury obviously is not great for humans. Thimerosal is a preservative that contains mercury. And so that is a very easy talking point. Why do we have mercury in vaccines? And not talking about, well, the amount of mercury that is in vaccines is less than you get just being alive in the world on a day-to-day basis. It's a minuscule amount. I think and I guess I'm talking here specifically about vaccines, but this also could be used more broadly. The challenge with addressing inaccurate information is that it very quickly becomes a game of whack-a-mole, where you explain to someone, okay, here's why thimerosal, you shouldn't be concerned about that. Okay, well then what about this? And I think that is, again, Heidi had talked about how there's still very high trust in people's individual doctors. Why I think that those of us who have the opportunity to talk to people, what is most effective is to say something like, I could talk to you all day and go through all of the fine points of all of the concerns you're raising. Let me tell you, though, the bottom line for me is I have kids. I've spent years looking into this, and my kids are fully vaccinated because I feel like that's the best way to protect them and to protect our family. I think that there can be variations of that on a much larger scale. Also, I think public health leaders, scientists, doctors speaking from the heart in that way, I think can be very effective. Instead of saying, what they're saying is crazy, don't listen to them, that's insane, etc., saying like, I get it. I get why this is scary. I get why it's so hard when you hear that things might be bad for your children. And I also get why this is so confusing. And so what I want to say is, I've looked into this community has looked into this for years, and this is why we feel very secure in these recommendations. But it has to be something that, again, as Heidi said at the outset, we're really starting years behind in doing that type of work, and that's gonna be a challenge.
Yeah, it's I think particularly the listening part that you were just talking about, Seth, and just having this empathy, because it is tough being a young parent today. I mean, there's so much out there. And I've talked to young parents who they lose sleep at night, particularly young mothers who are just wanting to do the right thing and so torn by the different views and emotive stories that it's really hard. So I think just having that um, empathy without getting panicked that you're going to be endorsing their views, just, having that empathy when you have that opportunity, because it's, it's different if you're sitting in an office with somebody versus online, because the problem online is, and understandably, some of the anxiety from the public health and science community is, people those who want to distort, cherry pick pieces of what you say. And I've seen all kinds of distortions of things I've said, some accidentally and some clearly purposefully. So it's hard. Um, but we've also learned a lot in terms of you don't want to take a piece of misinformation head on, because when you do that, you're just amplifying it. So finding ways, I call it kind of circle vaccinations, to figure out what the grain of the misinformation is and create alternative stories around it, because people are not getting the alternative stories online, certainly, as much as they could be with. And I think that even though I really um, totally agree with Seth that overall it's that emotive story that is going to compel someone, I usually try to do a mix of the emotive story, but then also a little bit of like, what's the scale of this? Like how much evidence we have. That's going to scare people, not scare people, but they'll gloss over if you're only doing that. But sometimes having a bit of both can help. We did a study, a control trial in the US and the UK with 8,000 people, just to understand, because I would get a lot of questions on, well, there's a lot of garbage and misinformation out there, but does it really affect people's health decisions? And so we shared 5 of the most frequently circulating pieces of misinformation in both sides, and then standard stuff. And we saw in both the US and the UK, uh, there was a 6% drop in willingness to take a vaccine after having seen those pieces of information. We made sure everyone before the end of the study knew that they were misinformation if they hadn't figured that out already. But um, yeah, it was really striking. It was both about 6%, and that was just one exposure.
Yeah, that's one of the I was about to say favorite, but I should say scariest studies around this was out of University of Michigan and involved people's ability to remember information that they were told is accurate versus information that they were told was inaccurate. And it was an experiment done with graduate students, so a pretty educated community. And they were given 20 statements and told these 10 statements are true and these 10 statements are false. And their recall a minute or 2 minutes or 3 minutes later was very good in terms of what was true and false. As quickly as 30 minutes later, though, it approached 50-50. So basically random, which shows that, one of the very successful efforts by disinformation campaigns is just to get the information out there. There's an old joke about a Chicago politician who starts a press conference saying, I have no evidence that my opponent has been convicted of a crime. And therefore, you inject into everyone's mind, oh, wait, was he convicted of a crime? What's going on here? And that's what you see with a lot of disinformation campaigns. And Heidi's exactly right. I mean, that's why addressing it is so challenging, because if you address it by stating what you're addressing at the outset, you run a very, very serious risk of increasing the number of people who think that, even if it's just within the context of this is not true.
Yeah.
It's very complicated. The scale and scope of the problem, the types of media, the lack of a singular trusted source to verify, etc. I've been weaving in some of the audience questions to my questions, but I'm going to turn a little bit more specifically to some of those now. One of the questions is about this: where are we, I'd say we as public health, or where are we going to find our accurate public health information influencer who can counter some of the other information? Is that going to, it's probably not going to be one person, it's multiple people, right? And it sounds like also we need the family physician and healthcare provider, and we need the group discussion. We need multiple levels of that. Would you agree, or thoughts on that?
Yeah, absolutely. I mean, when I was suggesting the idea of kind of ring vaccination, but with alternative stories, you need really an echo effect. I mean, because if it's just one, and this is sometimes where we miss the point in some of these studies on who do people trust. Well, they may trust scientists, but then, they trust X, Y, and Z higher, so they can get the good piece of information from a scientist or a doctor and then walk down the block and talk to the shopkeeper and hear something else or see a headline or bump into a friend who has a drama story that is exactly the opposite. In fact, we should try to get into as many different voices. And this is one of the on the vaccine space. I know this isn't just about vaccines, but one of the problems with vaccines, it's been very narrow in the focus. I worked a lot in HIV/AIDS and sexual reproductive health. Incredible engagement of just about everybody in different kind of engagement and communication campaigns. And we haven't done that so much in vaccination. I appreciate that it needs training to put in an injection, but still, we can do better. And I think we should really look at the innovation that happened during COVID at community level in all different ways. Vaccines were given in totally non-typical situations, but some of those we should think about, embrace, and they got into the communities in ways that we couldn't have imagined. And I think we need to really uh, embrace that and see how we might think about it in the long term.
Yeah, I mean, it's a great point. The first COVID vaccine I got was at Gillette Stadium, where the New England Patriots and the New England Revolution play. And I know a lot of other people who got vaccinated at Fenway Park, where the Red Sox play. And when I was there, I was thinking, like, this is such a great opportunity to turn this into something more than just you're standing in line and getting a shot. Like,
Yeah,
people
you get a hot
pay.
dog too, right?
Exactly. Exactly. People pay money just to go into Fenway Park when no one's there, when there's not a team playing, just to be inside. There are all sorts of other opportunities that we have that I think we don't necessarily take advantage of. Another thing that I think is a real challenge is that this tends to be something that has kind of single issue voters on one side who are
Yeah.
very vocal, and then a much larger group of people who are potential advocates, but also don't want to spend their lives just getting that point of view out, especially in today's social media environment where you can be the subject of so much vitriol and hatred. But if you look at the United States, where over 90% of kids are still getting pediatric vaccines, it's clear that the perception that people have overall, which is like this is a very contested issue, does not match the reality on the ground.
That's true.
And if everyone who was involved in public health and was involved in pediatric health and would speak out about this and just be public about this, I think it would help create a much different environment and a much different atmosphere. The problem is it's sort of hard to be first there, especially I know Heidi and I have both been the subject of some really hateful and hurtful things online and have developed a tough skin. It doesn't bother me now, but the first time I got a death threat and had to find out from the police, like, these are the types of death threats that we take seriously. That I had a moment of like, what am I doing here? Like, why don't I just go back and write about baseball? Like,
Yes.
um,
Yeah.
so it's a real challenge.
Well, that's very sobering.
Yeah.
Uh, I'm going to turn to a question from an audience member who's in Ethiopia, and welcome and thanks for joining from so far away. Speaking about how impactful misinformation and disinformation has been on their society in particular, and that some politicians, it's fertile ground for politics and politicians and even some religious leaders. And I think it speaks to some of the things we've already spoken on, but they're wondering how to try to dispel some of those beliefs and involvement in politicians and politics. Any specific thoughts on the global context there, or this issue? Is it more challenging in health systems that are less resourced or not?
Well, in terms of some of the countries, particularly in Africa, where we see like some of the highest trust is in faith leaders. I mean, there's also trust in scientists and trust in doctors, but faith leaders really rank. um, and one of the things that I think whoever is potentially undermining or accidentally spreading information, um, you need to try to understand what's driving it, because if you just try to counter it with a fact, it's just a non-starter. It usually fires it up, because sometimes, or what the public health community generally does, is get the right information out there. A lot of times it isn't about the information. And we've seen a situation, for instance, in Kenya, where there was, the Catholic bishops got very upset initially about a tetanus vaccine that usually, typically, the public health community, I mean, Department of Health, would involve them in any immunization campaign. And for some reason, that year they weren't involved. So they got suspicious and they went online and they found Depo-Provera, a contraceptive vaccine, has tetanus toxoid in it. Therefore, it's going to sterilize all of us. So that took a while to put that myth to bed. But then years later, it came up again. Again, it wasn't because they woke up one day and thought these vaccines sterilized. They went looking for some information because they were not included. And so I think what we should look at is why they started going and looking for alternative information, and be more inclusive and engage them more and work with them. And I had one, and I know we're running on time, but the Archbishop of Nigeria said to me once when I was working in UNICEF, Heidi, you people come to us with your good messages for our megaphones. And we're happy to spread the good words because we also want to save children's lives. But what you people don't do, and you should do, is you're not involving us in the planning. We know the good days, the bad days, the happy days, the sad days, and the rhythm of our communities. And you should come to us much earlier, because if we're there with you, we'll stay with you.
That's really powerful, Heidi, and I think the involvement of communities in health, in public health, in their own health is one of the biggest gaps, I would say, whether you're talking about the United States or Boston, where I am, or that example in Nigeria, is the tendency to be somewhat patronizing, which I think the time is just gone for now. We can't try to do that anymore because it's failing in many ways, and trying to engage communities in what they already know is the best way to address their own health seems really absolutely essential. We have another question about what to do in the context of the "I told you so." Specifically, the questions about AstraZeneca COVID vaccine side effects or adverse events that were considered initially as rumors, and now the vaccine is no longer being made available. How does one respond to that issue, especially if you started late, in being respectfully listening and taking your advice, Heidi, of empathetically listening to the rumors? Do we play catch up? How does that affect us?
I'll leave the hard ones to Seth.
Oh, I was just going to say, I'll leave that to you. Uh, um,
I can weigh in, but I'd love to hear what you think.
I mean, I think it shows how the public health community writ large, including vaccine manufacturers, including device manufacturers, how careful you need to be about putting business interests ahead of public health interests. And how even for a vaccine manufacturer, how doing something like that is going to hurt them in the long run. And yeah, so that's a huge issue. Every time someone can say, but look, here's an example of where we were told something and in fact they knew it was wrong, or it turned out to be wrong, is really, really damaging. Yeah, so.
And I think that comes back to one of the earlier points, Seth, you had at the beginning of our conversation was transparency and honesty.
Yeah.
And that, we just have to be straight with what we know, but also what we don't know. And certainly in the context of COVID, this was, even though we had what the scientific community said was enough evidence to feel like we can do this, it will, and relative to the issue of the day and the number of potential fatalities, let's go with this. And I guess also for the young men in particular, young boys, young men, who were more at risk there, I think they were particularly resentful too, because they felt like they weren't really at risk for the serious complications. So why did they have to take it in the first place? So it's something that I think we need to, I think we did say we didn't know everything, but maybe not enough.
Maybe not enough.
And also, acknowledging that there are, people were dying, hundreds of thousands of people were dying, and acknowledging that we are trying to deal with a fire hose of fatalities here. And we are doing the best we can in as safe a way as we can, instead of what I think ended up feeling like a much more defensive stance. And when the public has the sense that someone is being defensive, I think even if the reason for being defensive is because of old scars and old wounds about misinformation, that's not how that's going to come across to the public at large. But before we go, I just want to say very quickly, what an honor it is to be on this panel with both of you. Heidi has been an absolute hero of mine for decades, and Louise, the work you do with health equity in disadvantaged communities. It's what both of you are doing in terms of both advocating for public health and speaking out about it, and being public about it, is exactly what I think we need more of. And just the work that both of you do is really inspiring.
Well, I'm mutual admiration club here.
That's so kind of you to say, Seth, and I agree. It's Heidi has been an inspiration of mine for a long time, and your writing is so impactful, Seth. We have just 1 minute left, so I'd love to give you last word, anything you wanted to say and you didn't get to say, or any closing thoughts. Seth, maybe I'll give you 30 seconds and then let Heidi have
Sure,
the
yeah.
last word.
Yeah, I mean, I would just say for any people in the audience out there who are involved in public health in any way at all, you know, speak out to whatever extent you feel comfortable. You know, don't do something where you're not going to feel comfortable or feel like you're putting yourself in a situation you don't want to be in. But we need more people speaking out and more
Yes.
trusted people. And trusted people are the people that the public comes in contact with on a daily basis. We really need a groundswell of speaking out.
And I'll just use my 30 seconds to say thank you. So that's, I mean, it's really groundswell is important. This is not a time to be standing on
Yeah.
rooftops and trying to yell what you think is the truth, because we need a groundswell. We don't need the campaign approach. It will unfortunately make you risk becoming a target. So groundswell is what we need now, and we need as many voices as possible.
Thank you both so much. This has been incredible conversation. I've really learned a lot and enjoyed it. It's been an honor to have you both with us. Thanks to our audience for being here and for your engagement and questions. We're going to post this on our YouTube channel with some resources for everybody who wants to connect. Thank you all so much. Really appreciate it.
Thanks. You've been a
Thanks.
fantastic
Really appreciate
moderator.
it.
Thank you. Thanks.